Broccoli is often hailed as a superfood, loved worldwide for its health benefits, but did you know that eating it the wrong way can actually harm your body? In this video, we're going to uncover 15 dangerous broccoli mistakes that most people never talk about, mistakes that could lead to serious issues like stomach, liver, and pancreas damage, cardiovascular problems, and even kidney failure. From risky food combinations to improper cooking methods, you'll be shocked to discover how this nutritious vegetable can turn harmful if not handled correctly. Stay tuned until the end to learn how to avoid these critical mistakes and protect your health. This video is packed with crucial insights. If you're ready to take control of your well-being, don't forget to hit the like button, and let's dive in. Mistake 1. Consuming broccoli that contains pesticides and nitrates. Eating broccoli contaminated with pesticides and nitrates poses a serious health risk, increasing the likelihood of developing life-threatening diseases such as liver cancer, kidney cancer, pesticide poisoning, and nervous system damage. Broccoli, like many other vegetables, is often exposed to pesticides and fertilizers during its cultivation. These chemicals protect crops from pests and enhance yields, but they also introduce harmful substances into the food supply. Pesticides can accumulate in the tissues of the liver and kidneys, leading to long-term damage and an elevated risk of cancer. The body's inability to easily excrete these toxins contributes to their harmful impact over time. Nitrates, which are commonly used as fertilizers, add another layer of risk. Once consumed, nitrates are converted into nitrites in the body. These nitrites can then react with amino acids to form nitrosamines, compounds with carcinogenic properties. This chemical process increases the risk of stomach and digestive tract cancers. Research has consistently demonstrated that frequent consumption of foods high in nitrates and pesticides correlates with a heightened cancer risk. For example, a study published in Environmental Health Perspectives found that people who consumed pesticide-laden vegetables had a 20–30% higher chance of developing liver and kidney cancers compared to those who opted for organic produce. A case in point involves a 45-year-old woman from Los Angeles who suffered from chronic headaches, digestive issues, and fatigue. After doctors found high pesticide levels in her system, it was revealed that she frequently purchased vegetables, including broccoli, from local markets that didn't disclose information about their farming practices. Upon switching to organic produce, her symptoms drastically improved. To minimize the risks associated with pesticide and nitrate exposure, it's crucial to buy broccoli from trusted sources that guarantee the product was grown without harmful chemicals. Opting for organic vegetables is the safest choice. Additionally, washing broccoli thoroughly, preferably soaking it in a mixture of water and baking soda, helps remove any pesticide residues clinging to its surface. By making informed choices and taking the right precautions, you can enjoy the health benefits of broccoli without worrying about the risks of toxin exposure. Mistake 2. Roasting broccoli at high temperatures. Roasting broccoli at excessively high temperatures is another common mistake that can compromise your health. When exposed to high heat, particularly above 120 degrees Celsius, 248 degrees Fahrenheit, broccoli can produce harmful chemicals like acrylamide, a known carcinogen. Acrylamide forms in carbohydrate-rich foods that are cooked at high temperatures through methods like roasting, frying, or baking. This substance has been linked to mutations in cells, increasing the risk of various cancers, including stomach, colon, liver, and pancreatic cancers. Scientific studies back this up. A study published in the Journal of the National Cancer Institute revealed that individuals who regularly consumed fried or roasted foods were 50% more likely to develop stomach cancer compared to those who boiled or steamed their vegetables. Acrylamide, along with other carcinogens formed during high-heat cooking, can have a cumulative toxic effect on the body. Prolonged exposure to these toxins increases the chances of mutations in cells, leading to an elevated cancer risk. A documented case in Chicago highlights this issue. A 58-year-old man, diagnosed with stomach cancer, had a daily habit of roasting broccoli in olive oil at high temperatures. He believed this method preserved the vegetable's nutrients. However, his doctors identified that frequent exposure to acrylamide was a significant contributing factor to his cancer diagnosis. To avoid these risks, it's best to steam broccoli or cook it at lower temperatures. Steaming preserves the vegetable's natural antioxidants and vitamins, which are beneficial for health, while minimizing the risk of carcinogen formation. If you prefer roasting, make sure the cooking temperature does not exceed 120 degrees Celsius, and keep the cooking time to a minimum. By choosing gentler cooking methods, you can enjoy broccoli's full health benefits without exposing yourself to dangerous toxins. Mistake 3. Consuming raw broccoli. When immunocompromised, consuming raw broccoli can pose significant health risks for immunocompromised individuals, including those with weakened immune systems due to age, chronic illness, or medication. While raw broccoli is often lauded for its high nutrient content, it can also harbor harmful bacteria like E. coli and Salmonella. These bacteria can easily contaminate vegetables during growth, harvest, or transportation. For healthy individuals, the immune system can usually fight off such infections, but for people with compromised immune systems, the risk of infection is much higher. Research published in the Journal of Food Protection indicates that about 30% of outbreaks related to raw vegetable consumption are caused by E. coli and Salmonella. Immunocompromised people, including the elderly, children, pregnant women, and those with chronic health conditions, are particularly vulnerable. In one documented case, a 70-year-old man with diabetes and immunodeficiency was hospitalized after consuming a raw broccoli salad. He developed a severe case of salmonellosis, which doctors traced back to improperly washed broccoli. To avoid these risks, it's essential to wash broccoli thoroughly before eating it raw. For those with weakened immune systems, it's best to cook broccoli, either by steaming or lightly frying it. Heat treatment kills harmful pathogens while retaining most of the vegetable's nutritional value. By properly washing and, when necessary, cooking broccoli, you can minimize the risk of infections without sacrificing the vegetable's health benefits. Mistake 4. Insufficient heat treatment of broccoli. Failing to heat broccoli adequately during cooking can expose you to harmful bacteria and increase your risk of foodborne illnesses. Vegetables, including broccoli, can harbor dangerous pathogens like Salmonella and E. coli, which can survive if the vegetable isn't cooked at the right temperature for a sufficient amount of time. These bacteria can cause severe gastroenteritis, characterized by symptoms like vomiting, diarrhea, and abdominal pain. Studies show that inadequate heat treatment is a leading cause of foodborne illnesses. For instance, a study published in the Journal of Food Protection found that 25% of food poisoning cases were linked to vegetables and other foods that hadn't been thoroughly cooked. In a Miami hospital, a 35-year-old woman developed severe gastroenteritis after eating steamed broccoli that hadn't been cooked long enough to kill Salmonella bacteria. Her recovery took several weeks, and she required antibiotics to fully recover. To prevent infections, it's recommended that broccoli be cooked at a temperature of at least 70 degrees Celsius, 158 degrees Fahrenheit, for 5-7 minutes. Boiling, steaming, or roasting broccoli at this temperature ensures that harmful bacteria are destroyed while preserving the vegetable's beneficial nutrients. By following these guidelines, you can safely enjoy broccoli without the risk of foodborne illness. Mistake 5. Storing broccoli in plastic containers. Storing broccoli in plastic containers for long periods is a common mistake that can have serious health consequences, including an increased risk of breast and prostate cancers, as well as endocrine disruption. Many plastic containers contain bisphenol A, BPA, a chemical that is known to interfere with the body's hormonal balance. When food is stored in plastic, particularly at elevated temperatures or over extended periods, chemicals like BPA can leach into the food, increasing the risk of long-term health problems. Research has linked BPA exposure to a higher incidence of hormone-related cancers. A study published in Environmental Health Perspectives found a significant correlation between BPA exposure and the development of hormone-dependent tumors. Another case, reported in a London hospital, involved a 42-year-old woman who developed breast cancer after years of storing and heating vegetables in plastic containers. High levels of BPA were detected in her system, which may have contributed to her cancer diagnosis. To minimize these risks, avoid storing broccoli and other foods in plastic containers, especially for long durations. Glass or ceramic containers are safer alternatives. Additionally, never heat food in plastic containers, as this accelerates the release of harmful chemicals. By switching to safer storage practices, you can protect your health and reduce your exposure to endocrine-disrupting chemicals. Mistake 6. Consuming broccoli with intestinal disorders. For individuals suffering from gastrointestinal conditions such as irritable bowel syndrome, IBS, chronic constipation, or abdominal bloating, consuming broccoli can exacerbate symptoms. While broccoli is a nutrient-dense vegetable, high in fiber and packed with antioxidants, it may cause discomfort for people with bowel disorders. The fiber content in broccoli, particularly insoluble fiber, can lead to increased bloating, gas, and abdominal pain, especially when consumed in excess. Fiber plays an essential role in maintaining healthy digestion, but individuals with IBS or similar disorders often have hypersensitive guts. For them, an overload of fiber can trigger an exacerbation of symptoms. According to a study published in the American Journal of Gastroenterology, around 70% of IBS patients experienced worsened symptoms after consuming high-fiber foods like broccoli. Insoluble fiber, which does not dissolve in water, can be particularly harsh on the intestinal walls, leading to inflammation and pain. In one reported case, a 45-year-old woman with IBS added large amounts of broccoli to her daily meals, believing it would improve her health. However, she soon began experiencing severe abdominal pain and bloating. Upon medical advice, she reduced her broccoli intake, and her symptoms improved significantly. For those with intestinal disorders, moderation is key. Opting to steam or boil broccoli can make the fiber easier to digest and reduce its harsh impact on the gut. Additionally, combining broccoli with probiotic-rich foods, such as yogurt, may support a healthier gut environment by promoting beneficial bacteria. Maintaining a balance between fiber and fluids, by drinking plenty of water throughout the day, can also help prevent worsening symptoms. Taking a personalized approach to diet based on one's condition and consulting with a healthcare professional can help maintain digestive health while avoiding flare-ups. Mistake 7. Excessive consumption of broccoli for pancreatic diseases. Although broccoli is packed with essential vitamins, minerals, and fiber, it can cause serious issues when consumed excessively by people suffering from pancreatic diseases such as pancreatitis, pancreatic insufficiency, or diabetes. The pancreas plays a critical role in digesting food by releasing enzymes, and excessive fiber, as found in broccoli, increases the need for pancreatic enzyme production, placing additional strain on the organ. For people with chronic pancreatic conditions, like pancreatitis, the pancreas is already compromised, making it difficult for the body to process fiber-rich foods. This added burden can lead to a worsening of symptoms, including severe pain and digestive complications. A study published in Pancreas Journal demonstrated that high-fiber diets in individuals with chronic pancreatic disease required excessive enzyme secretion, ultimately exacerbating their condition. In a specific case at a New York clinic, a 50-year-old man with chronic pancreatitis began consuming large quantities of broccoli, believing it would enhance his health. However, after a few weeks, his condition deteriorated rapidly, with symptoms like severe abdominal pain and nausea. His doctors attributed this to the increased workload on his pancreas caused by excessive fiber intake. To minimize strain on the pancreas, those with pancreatic conditions should consume broccoli in moderation. Steaming or boiling the vegetable until soft can reduce the fiber content, making it easier to digest. It's also recommended to consult a healthcare provider or nutritionist to create a diet that minimizes stress on the pancreas while still providing the necessary nutrients. Overconsumption of broccoli for those with pancreatic disease can worsen symptoms, but a thoughtful and balanced approach to diet can prevent this and promote better pancreatic health. Mistake 8. Consuming broccoli for liver disease. While broccoli is generally regarded as a health-boosting vegetable due to its rich content of vitamins, minerals, and antioxidants, excessive consumption can pose risks for individuals suffering from liver diseases such as fatty liver disease, cirrhosis, or liver failure. The liver plays a central role in detoxifying the body and processing nutrients, and in a weakened state, excessive intake of certain nutrients, like those found in broccoli, can overwhelm the liver. Broccoli is high in both fiber and sulfur-containing compounds, like glucosinolates, which require active liver metabolism. In individuals with compromised liver function, this additional metabolic workload can lead to toxin buildup and further deterioration of the organ. A study published in Hepatology highlighted that patients with chronic liver disease should be cautious of high-fiber diets, which can overtax an already struggling liver. A real-world example involves a 55-year-old man suffering from fatty liver disease, who added large quantities of broccoli to his daily meals, assuming it would be beneficial. Unfortunately, after several months, his condition worsened, with symptoms such as jaundice and decreased appetite. Doctors determined that excessive broccoli consumption had placed an undue burden on his liver, exacerbating his condition. For people with liver disease, it's important to consume broccoli in moderation and avoid overloading the liver with excessive amounts of fiber and other compounds. A diet that includes a variety of vegetables in balanced portions can help maintain liver health without causing harm. Consulting a healthcare provider or nutritionist to develop a liver-friendly diet is crucial. Overall, mindful consumption of broccoli and other nutrient-dense foods can help manage liver conditions and prevent worsening symptoms. Mistake 9. Consuming broccoli in the presence of kidney stones. Broccoli may seem like a universally beneficial vegetable, but for those with kidney stones or other chronic kidney conditions, it can actually pose a risk. Broccoli, like many other green vegetables, contains oxalates, compounds that can bind with calcium in the kidneys to form insoluble crystals. These crystals contribute to kidney stone formation, which can cause severe pain and impair kidney function. For people prone to urolithiasis, kidney stone formation, excessive consumption of oxalate-rich foods, including broccoli, can aggravate their condition. A study in the Clinical Journal of the American Society of Nephrology revealed that high consumption of oxalate-containing foods significantly increases the risk of kidney stone development in susceptible individuals. Those with existing stones or chronic kidney disease may find that broccoli worsens their symptoms or promotes the formation of new stones. An example from a Boston hospital involved a 38-year-old woman with recurrent kidney stones. Unaware of the oxalate content in broccoli, she included the vegetable in her diet daily. Over time, doctors found that broccoli had contributed to the development of new stones. After switching to a low oxalate diet, her condition improved dramatically. For individuals with kidney stones or chronic kidney disease, it's crucial to monitor dietary oxalate intake. Maintaining a balanced diet that includes foods rich in calcium and magnesium, which can help reduce oxalate absorption, is key to preventing stone formation. Consulting with a healthcare provider or dietitian to tailor a kidney-friendly diet can help avoid complications. Moderation and awareness of oxalate content in foods like broccoli can go a long way in protecting kidney health. Mistake 10. Consuming broccoli with gastritis or a stomach ulcer. Despite its numerous health benefits, broccoli can be problematic for people with gastrointestinal conditions like gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD. The high fiber content and natural acidity in broccoli can irritate the already inflamed mucous membranes of the stomach, exacerbating symptoms of these conditions. For individuals with gastritis or ulcers, consuming broccoli raw or in large quantities may lead to increased inflammation, abdominal pain, and heartburn. The rough nature of fiber in broccoli can further irritate the stomach lining, prolonging the healing process for ulcers and causing significant discomfort. A study in the World Journal of Gastroenterology indicated that patients with peptic ulcers who consumed high-fiber, acidic foods were more likely to experience symptom flare-ups and longer recovery times. A notable case involved a 60-year-old man from San Diego with chronic gastritis. He began consuming broccoli regularly, thinking it would enhance his health. However, after a few weeks, he experienced severe stomach pain and heartburn. Doctors discovered that broccoli had aggravated his gastritis by irritating his stomach lining. For individuals with gastritis, peptic ulcers, or GERD, consuming broccoli in moderation and choosing gentler preparation methods is recommended. Cooking methods such as steaming or boiling can reduce the fiber's harshness and lower broccoli's acidity, making it easier on the stomach. Additionally, controlling portion sizes and avoiding broccoli on an empty stomach can help prevent discomfort. Consulting with a healthcare professional or dietitian can guide safe dietary choices for managing these gastrointestinal conditions while still reaping the benefits of a healthy diet. Mistake 11. Excessive consumption of broccoli with thyroid disease. For individuals suffering from hypothyroidism or other thyroid disorders, consuming too much broccoli can pose a serious health risk. Broccoli, along with other cruciferous vegetables, contains compounds known as goitrogens. These compounds can interfere with the thyroid gland's ability to absorb iodine, which is essential for producing thyroid hormones. These hormones regulate metabolism, and any disruption in their production can lead to a cascade of health issues, including weight gain, fatigue, and metabolic disturbances. In the case of hypothyroidism, the thyroid gland is already underperforming, and excessive consumption of goitrogens can further exacerbate this condition. A study published in Thyroid Journal highlighted how regular intake of goitrogenic foods like broccoli could negatively impact thyroid function, especially in individuals with pre-existing thyroid conditions. A clinical case reported at a Boston medical center involved a 45-year-old woman with hypothyroidism whose condition worsened after increasing her broccoli intake, resulting in more severe symptoms such as constant fatigue and weight gain. To avoid aggravating thyroid issues, people with thyroid disorders should consume cruciferous vegetables like broccoli in moderation and ensure they are getting enough iodine from other sources like seafood, iodized salt, or supplements. Consulting an endocrinologist can help tailor a diet that supports thyroid health without compromising nutrient intake. Thus, while broccoli is rich in nutrients, overconsumption can worsen hypothyroidism by exacerbating iodine deficiency and reducing thyroid hormone levels. Maintaining balance in the diet and monitoring food choices is essential to promoting thyroid function and overall well-being. Mistake 12. Overconsumption of broccoli for anemia. Although broccoli is a highly nutritious vegetable, overconsumption can negatively affect individuals suffering from iron deficiency anemia. This condition is characterized by a lack of sufficient iron in the body, leading to symptoms like chronic fatigue, weakness, dizziness, and compromised immune function. While broccoli does contain beneficial nutrients, it also contains phytates and oxalates, substances that can bind to iron and reduce its absorption in the body. Iron deficiency anemia already involves low iron levels, so consuming large quantities of broccoli may make it more difficult for the body to absorb the iron it needs from other foods. A study published in the Journal of Nutrition found that cruciferous vegetables like broccoli could significantly reduce iron bioavailability due to the presence of phytates and oxalates, especially when consumed in excess without proper iron supplementation. A clinical case reported at a Los Angeles clinic involved a 30-year-old woman with anemia. She increased her intake of broccoli, believing it would improve her overall health, but instead, her anemia symptoms worsened. After a blood test, doctors discovered her iron levels had dropped, largely due to the excessive consumption of broccoli. Nutritionists recommended she reduce her intake of cruciferous vegetables and increase her consumption of iron-rich foods such as meat and fish. For individuals with anemia, it is essential to strike a balance. Limiting foods that inhibit iron absorption and incorporating heme iron sources, which are more easily absorbed by the body, can help manage anemia. Overconsumption of broccoli can reduce iron availability and exacerbate anemia symptoms, so moderation is key. Mistake 13. Consuming broccoli while taking anticoagulants. For those on anticoagulant medications, such as warfarin, consuming large amounts of broccoli can pose significant health risks. Broccoli is rich in vitamin K, a nutrient that plays a critical role in blood clotting. Anticoagulants work by thinning the blood to prevent dangerous clots from forming, which helps reduce the risk of heart attack and stroke. However, consuming too much vitamin K can counteract the effects of these medications, leading to an increased risk of bleeding or blood clot formation. A study published in the British Journal of Clinical Pharmacology highlighted how high intake of vitamin K from foods like broccoli, spinach, and kale could diminish the effectiveness of anticoagulants, potentially causing dangerous bleeding complications. A case at a New York City hospital illustrated this risk, where a 65-year-old man on warfarin experienced bruising, dizziness, and abnormal clotting due to excessive broccoli consumption, which led to dangerously low blood clotting levels. For individuals on anticoagulants, it is crucial to maintain a consistent vitamin K intake to avoid sudden fluctuations that could interfere with medication efficacy. Consulting a healthcare professional can help create a balanced diet plan that ensures safety while maintaining proper vitamin K levels. Overconsumption of broccoli while on blood thinners can lead to serious complications, so a mindful approach to nutrition is necessary. Mistake 14. Consuming broccoli for heart disease. For individuals with heart disease, such as coronary artery disease, atherosclerosis, or heart failure, consuming large amounts of broccoli can pose significant health risks. While broccoli is highly nutritious, its high vitamin K content can be problematic for heart patients, especially those on anticoagulant medications. Vitamin K plays a crucial role in blood clotting by promoting the formation of prothrombin, a protein responsible for clot development. For heart disease patients, excessive clotting can increase the risk of thrombosis, which may lead to life-threatening conditions like myocardial infarction, heart attack, or stroke. Research published in the Journal of the American College of Cardiology has shown that in patients with cardiovascular disease, excessive consumption of foods high in vitamin K, such as broccoli, may hinder the effectiveness of anticoagulant medications. These medications work by reducing blood clot formation, and high levels of vitamin K can counteract this effect, leading to cardiovascular complications. In one case reported at a Chicago clinic, a 58-year-old man with chronic coronary artery disease began experiencing symptoms of increased blood clotting after introducing large amounts of broccoli into his diet. Tests revealed that his elevated vitamin K intake was contributing to his heightened risk of clot formation. By adjusting his diet and reducing his consumption of broccoli, his condition stabilized. For those with cardiovascular disease, it is vital to monitor vitamin K intake carefully. Patients taking anticoagulants, such as warfarin, should maintain a consistent intake of vitamin K to avoid disrupting the balance of their medication. Consulting a doctor or nutritionist is essential for creating a heart-healthy diet that manages vitamin K levels while minimizing the risk of thrombosis or other complications. Overconsumption of broccoli for heart disease can lead to serious consequences, so a cautious approach to nutrition is necessary to protect heart health. Mistake 15. Consuming too much broccoli. While broccoli is widely celebrated for its nutritional benefits, overconsumption can lead to health risks, particularly for individuals who may be unaware of the potential dangers of excessive nutrient intake. Broccoli is packed with vitamins A and K, which are essential for proper body function. However, consuming too much of these vitamins can lead to hypervitaminosis, a condition characterized by the toxic buildup of vitamins in the body. Hypervitaminosis A can result in symptoms like headaches, nausea, liver dysfunction, and skin rashes. In severe cases, long-term excessive intake of vitamin A can lead to serious liver damage. Similarly, excessive vitamin K intake can disrupt the body's natural blood clotting processes. It may cause either increased bleeding due to impaired clotting or, conversely, excessive clot formation, thrombosis, both of which can have dangerous consequences. A case study reported by a San Francisco clinic involved a 40-year-old man who consumed large amounts of broccoli daily, believing it to be highly beneficial for his health. Over several months, he developed symptoms of constant headaches, nausea, and skin problems. Medical tests revealed that he had developed hypervitaminosis A, which led to liver dysfunction and skin conditions. His doctors advised him to reduce his broccoli intake to more moderate portions, leading to an improvement in his symptoms. To avoid hypervitaminosis, it is crucial to consume nutrient-rich foods like broccoli in moderation. Excessive intake of fat-soluble vitamins, particularly vitamins A and K, can have toxic effects on the body. Experts recommend a balanced diet that ensures adequate nutrient intake without risking the dangerous effects of overconsumption. Moderate consumption of broccoli can provide its benefits without compromising health. Broccoli is often celebrated as a nutritional powerhouse, packed with vitamins, minerals, and antioxidants that support overall health. However, even with such a beneficial food, it's important to remember that moderation is key. While broccoli offers numerous health advantages, consuming it in excessive amounts or not preparing it correctly can lead to unwanted effects on the body. By taking a more mindful approach to its consumption, you can enjoy its benefits without any negative consequences. One of the primary reasons people turn to broccoli is its high content of essential vitamins, particularly vitamins A and K. Both are vital for bodily functions, with vitamin A supporting vision and immune health, and vitamin K playing a critical role in blood clotting. However, these vitamins are fat-soluble, meaning the body stores any excess instead of excreting it. Over time, this can lead to hypervitaminosis, a condition caused by excessive amounts of vitamins in the body, potentially causing symptoms like liver dysfunction, headaches, nausea, or skin problems. It is essential to recognize that while these nutrients are beneficial in moderation, overloading the body can have the opposite effect. Take, for instance, the case of a man who believed that increasing his broccoli intake would maximize his health benefits. He began consuming large portions daily, but after several months, he experienced constant headaches, nausea, and skin issues. Medical tests revealed that he had developed hypervitaminosis A, which contributed to liver malfunction and other symptoms. This case illustrates the importance of moderation, even with foods considered healthy. By reducing his broccoli intake, his health stabilized, underscoring the need for a balanced approach to eating. In addition to hypervitaminosis, consuming too much broccoli can also affect those on certain medications. Broccoli is known to contain high levels of vitamin K, which can interfere with blood-thinning medications like anticoagulants. This can result in an increased risk of blood clotting, which is particularly dangerous for individuals with cardiovascular disease. For this reason, patients on such medications should monitor their vitamin K intake carefully. Rather than eliminating broccoli altogether, a stable and consistent consumption of foods containing vitamin K can help avoid any complications related to drug interactions. To enjoy the full benefits of broccoli without overloading the body, it's best to consume it in moderation. A serving of 1 to 2 portions a day will provide plenty of vitamins, minerals, and antioxidants without overwhelming the system. Incorporating a variety of vegetables and nutrient sources into your diet ensures you receive the benefits of different nutrients without excessive amounts of any one. How broccoli is prepared also plays a crucial role in retaining its nutrients. Cooking broccoli for too long or at high temperatures can reduce its nutritional value and even produce harmful substances like acrylamide, a carcinogen formed during high heat cooking. To preserve the vitamins and minerals in broccoli, it's best to steam or boil it for no more than 3 to 4 minutes. This method helps to maintain its crisp texture and keeps its nutrients intact, offering a much healthier option compared to frying or overcooking. Storage is another important aspect to consider. Broccoli should be stored in the refrigerator, ideally in glass or ceramic containers to avoid contact with harmful chemicals that can leach from plastic. If freezing is necessary, be sure to cook the broccoli immediately after defrosting to prevent the loss of quality and potential bacterial growth. Proper storage ensures that broccoli retains its nutritional value for longer, maximizing the health benefits you receive from each serving. Another tip for enhancing the health benefits of broccoli is to combine it with foods rich in vitamin C. This can help improve the absorption of iron from broccoli, especially for individuals prone to anemia. Pairing broccoli with foods like lemon or sweet peppers ensures that your body gets the most out of the nutrients, helping to prevent any deficiencies and promote better overall health. That said, broccoli can be an essential part of a healthy diet, offering numerous benefits when consumed in moderation and prepared properly. By paying attention to how much broccoli you eat, how you prepare it, and how you store it, you can enjoy its positive effects without the risk of health complications. A mindful approach to nutrition, including a variety of foods and balanced portions, can keep your body functioning optimally and allow you to make the most of what broccoli has to offer. Always remember that consulting with a nutritionist or healthcare professional can help tailor your diet to your specific needs, ensuring that you receive all the nutrients you need without any risk of overconsumption. In conclusion, broccoli is undeniably a valuable addition to any diet, but as with any food, moderation and mindfulness are crucial. By balancing your intake and preparing it in a way that preserves its nutrients, you can safely incorporate broccoli into your meals, boosting your health while avoiding potential risks. If you found this information helpful, be sure to like this video and subscribe to our channel for more tips on how to master your health through smart nutrition and lifestyle choices. Don't forget to hit the notification bell so you never miss our latest content. Have questions or want to share your thoughts? Drop a comment below. We'd love to hear from you. Stay healthy and see you in the next video.